going to remove my neck collar, which I am allowed to do, but if any of you see my head wobbling, please intervene and I'll put it straight back on. And may I congratulate the new member to his place, and the respect that he talks about and commands, I'm sure he'll be an asset to this House. Now, I come with a slightly unique perspective to this debate, and 3 minutes is very short to try and make that point, but I've been a doctor since 2007. I sat on the Health Select Committee for 3 years, and most recently, and probably most obviously, have recently had spinal surgery on my neck, but that's not my only foray into the NHS. I've had both knees operated on, my shoulder operated on, had my appendix out and ended up on intensive care with bilateral pneumonia after that. So I've seen a fair way of looking around it. Absolutely. But one of the things that, when it comes to this debate, is the political football and the political nature around health. And it always strikes me that there is a rising tide across the Western world, and indeed these 4 points of the nation. If we think in Scotland it's run by the NHS is run by the SNP, in Wales it's run by Labour, in Northern Ireland it's also separate, and we had the Conservatives now handed over to Labour. All of them are struggling, and we should do well to remember that. Now, I actually came into politics not to change the world, but to solve it. It sounds cheesy, and in these last 2 minutes I've got a set of suggestions, and as any good doctor would do, look at the short term, the mid-term and the long term to try and help improve this. Now, we could start this by doing a root and branch review into prescribing. It's one of the most wasteful things you will ever see in the NHS. On top of that, there's worth looking at the European Working Time Directive that hampers doctors when they're studying. Overnight, that could increase by a couple of percentage points the ability to see more patients. Communications, as someone who spent 9 months waiting for this operation, the number of letters, appointments are caught up. I have the ability to understand that and work my way through it. But a root and branch review in communications, the simple bread and butter of the NHS, would be very welcome. And comparable data across the nations, being able to see what goes on, is so important. For the medium term, I'd like to see statementing when people go into the NHS. Everyone knows how much it costs when they go to America, and it's £40,000 having your ski accident. It costs that much here. People would do well to remember that when they don't turn up to their appointments. The IT system, we focus a lot on patients, but I'd like to see more done to focus on the staff and how they can use IT. And in terms of GPs, I'd like to see capping of list sizes. This is a sensible way now. We have a workforce plan in place to be able to allow us to grow our staffing with it. But finally, when it comes to long term, and in my 20 seconds, I'll suggest having a national service for SEND, taking education and health together to deal with mental health. 40% of the CAMHS referrals in Leicestershire are dealt with autism and ADHD. And for me, that is a real problem that could easily be solved. And with my final 5 seconds, an NHS centre for clinical excellence to share best practice. It's not good enough. Yeah.